Hey everyone, welcome to the Canine Culture Podcast, where we talk about everything dog. Q&As with veterinarian professionals, rescue operators, everyday topics. We cover everything dog on this podcast. So make sure you subscribe to the Canine Culture Podcast on your favorite podcast platform, and make sure you're following us on social media on both Instagram and Facebook. Thanks again for listening. Now here's that next episode. Hey everyone, welcome to the Canine Culture Podcast. This is your host, Brittany, and today we are joined by Marie Zollo. She is a veterinarian at AMC in New York City. So Anne, thank you for joining us today.
Thank you, Brittany, for having me. I'm super excited to be here.
So I've actually been, unfortunately, a patient at AMC. We had an emergency when we lived in New York City, and they're just known for having some of the best care. And when we went, they got us right in. They saw Titan really quickly. They kind of gave us everything we needed. We were out the door in hours. I kind of wish I could go to the ER there, honestly.
Yeah, we definitely have people tell us that. I feel very fortunate to get to work at the Animal Medical Center, one of the few level 1 veterinary trauma centers in the country, which is really cool to be able to say. And we do have a very well-oiled machine for our ER, which is awesome. We try to get people in and out quickly, give them the information that they need, and get their pets treated, and treat the owners too, because a lot of times when you're coming into the ER, it's a super stressful time for owners, and it can be a time of crisis for them. So any comfort we can provide to them as well, we're happy to do so.
Mm-hmm. Well, you guys are doing a great job, so I have to give that feedback.
Thank you. Thank you. I appreciate that.
So today's topic could touch on things that might bring you into the ER, and we're going to talk about why do dogs throw up, and at what point in an episode of throwing up should the owner go to the ER. So let's talk about first some of the most common reasons that dogs throw up, or maybe some of the most common things that you see when a dog comes in and they're throwing up. Like, what are some of those that you see regularly?
Sure. So just like people, dogs can throw up for many different reasons. As veterinarians, when we think about why a dog might be throwing up, we often will say it can be related to primary gastrointestinal causes or things outside of the gastrointestinal tract that can make a dog vomit. And within those things, we think about the age of the pet, what their lifestyle is, and that can kind of help us narrow down what the causes could be. So when we talk about primary gastrointestinal causes, can range from anything from infectious diseases, especially in younger patients, puppies, unvaccinated dogs always has to be high on our list of causes. Can be eating things. We talk about garbage gut. If a dog got into the garbage, or dogs eat things off of the street. Even if a dog it's as simple as a dog was fed a new treat, a new food, that can even cause it. More significant things that we think about when we talk about primary gastrointestinal causes would be things like a foreign body obstruction. So, some dogs are very notorious for eating foreign objects, socks, pieces of their toys. That can cause an obstruction in the gastrointestinal tract. And then we think about more serious things like a bloat or a GDV rather. So that something that's very serious and can be a cause of vomiting in dogs. And then there are a lot of things outside of the gastrointestinal tract that can cause vomiting. If dogs have kidney disease, liver disease, pancreatitis, all of those things can ultimately cause vomiting as well. So, the causes are very varied, and a lot of how you narrow it down depends again on, how old the pet is, what their lifestyle is, do the owners know that they got into something, and then based on diagnostic results as well.
And I think it's safe to say if you saw your dog pick up a chicken wing on the street and they start throwing up, they probably want to come into the ER if they can't get into their everyday vet, their primary vet.
Yes, yes, for sure. I would say that's true. The good thing about chicken bones is that if they're small, those will actually usually dissolve on their own, which is super fortunate. But sometimes while the dog is feeling sick from eating it, they need some supportive care with anti-nausea medications and potentially fluids while their body is working to dissolve those chicken wings. There are definitely some types of bones that are much more dangerous for dogs. Particularly like pork bones are very notorious for causing more problems, so definitely have to be careful with those. But if your dog does eat a chicken wing off of the street, which it does seem like there are a fair number of chicken wings on the street at times, that is something that fortunately usually will dissolve. But again, if they have an upset stomach from it, they often need supportive care.
Mm-hmm. And aside from the obvious, like I saw my dog eat this, whether it's a chicken bone, 10 socks, which I've seen on social media lately. That's the other
Yes.
thing I've
Yep.
seen. But let's say you have no idea. You just, your dog is vomiting. When when is kind of that timeline or what is that trigger? So whether it's time or symptom that an owner is like, okay, now is time for the ER. Like what should we be looking for?
Yeah, I think that's something that's really important to talk about, because you certainly don't want to wait too long and go when you're a few steps behind. So I would say that if your pet has a single episode of vomiting and they're otherwise acting normally, they're still energetic, then you're usually okay to wait. But if your pet vomits multiple times in 24 hours, or especially multiple times in quick succession, like a few times in an hour, if they're collapsed, if they're weak, if they're drooling a lot, that's always a big sign to me that something's really bothering their stomach. Anything like that, profuse diarrhea, then I say come in. I always say to people, you know your pet best. You know your pet better than I do. I don't live with them. So if you feel like something is off, I always say it's much better to come in and let us check them out. The old saying, better to be safe than sorry. And hopefully it's something simple and we can give them an anti-nausea injection and send you on your way. But if it's not simple, it's better to catch it early rather than to wait too long. So that would be, some general rules that I would live by for this.
hmm And when someone does come to the ER, I know every ER is pretty different. Some might just go ahead and throw the kitchen sink. I know some might be a little bit more conservative and say, all right, first, let's do an x-ray. Second, let's do blood work. So what is traditionally your approach? And I know it might differ depending on like the state or the condition of the dog, but if you're in a position that an owner would be in and they're trying to make a very educated decision, what do you think are kind of those high level tests that are priority to run in this case?
Yeah, that's a very good question. And I think for me, it depends on a few things. In general, it will depend on what my physical exam looks like, and then what my index of suspicion for these different causes are, and what an owner wants. So I'll have some owners that come in and I tell them, before I even examine the dog, based on your pet's age and, what they tend to do at home, these are my top differentials or causes for what this might be. And they say to me, I don't want to do things stepwise. I want to do every test that you could possibly do. And then sometimes in those cases, I will start, with whatever the owner wants. But in general, things that I look for on my physical exam that tell me we, need to do some sort of imaging of the abdomen, whether it be x-rays or an ultrasound, would be things like abdominal distension. So if the abdomen is larger than I would expect it to be or bloated, that's a big sign for me that animals need some diagnostics. And another really big one is pain. So if I palpate or feel a dog's abdomen and it's super soft, they don't react, they don't seem nauseous, then that makes me less suspicious for a more serious or sinister process going on, or something that requires surgical intervention. So in those cases, if my index of suspicion for a surgical process is low and the dog is super comfortable, or they don't seem very nauseous when I feel their belly, then I might say to the owner, I think we can forego abdominal imaging at this time and treat supportively. But if there's abdominal pain, if when I feel the belly the animal is like retching or seems super nauseous, or if the abdomen is distended, then those things to me say, okay, this animal needs some sort of abdominal imaging. And in general, the two main ways that we image the abdomens of dogs are x-rays or ultrasound. So you may hear your vet talk to you about both of those things. X-rays are a really good screening test for foreign body obstruction. So they're a good test to be able to see that. So if you have a young dog who's vomiting a lot, it's a Labrador that likes to eat your socks, then your vet will very likely say to you, we should take some x-rays of the belly to make sure that we don't see foreign material or an obstruction. If you have an older pet or an older dog who is vomiting, and the index of suspicion for something like an obstruction is lower, because as dogs age, they tend to get a little bit wiser and don't do all of those, naughty things anymore, then we might say to you, it makes more sense to go right to an ultrasound or a sonogram, because we can see, all of the organs in more detail, and that will potentially be a higher yield test. So, abdominal imaging via x-ray or ultrasound, big tests, and then blood work. That's another thing that can be really useful for us. Blood work can help us tell if there is something going on outside of the gastrointestinal tract that's causing vomiting. Check your kidney values, check your liver values, and we can also check electrolytes, which there are certain patterns of electrolytes that can raise suspicion for us for something like an obstruction. So again, the process is very, very tailored to the individual patient and owner, and kind of depends on what your physical exam is saying. How likely is it that this dog has something surgical going on? Because if that's the case, then you definitely want to do some sort of abdominal imaging, and what the owner's wishes are. There's some people who prefer to be more conservative and start with supportive care and then say, I'll come back if things don't go well, versus there's some owners that just while they're there, they want to do all the tests to make sure that they rule everything out.
Mm-hmm. And I feel like a lot of people, they're kind of the mindset of, well, if they're just throwing up, it's okay. But if they're throwing up and they have diarrhea, we have a problem. I mean, would you say that adding diarrhea to the equation of vomiting is a little bit more worrisome? Or do you think we're still in kind of that same bucket of, well, we still need to learn a little bit more, dig a little bit more?
Yeah, so it's actually interesting. If I have a young, otherwise healthy dog who's having both vomiting and diarrhea, it actually makes me a little bit less worried that there's something surgical going on. Because obviously, when you see a pet with vomiting, you always want to make sure as a veterinarian that you're not missing a surgical problem. You don't want to send an animal home who actually needed surgery. Mm-hmm. And when they're having both vomiting and diarrhea, sometimes that lessens my suspicion for something like an obstruction. A lot of times when a dog has an obstruction, they're not defecating because nothing can really get past the obstruction. Mm-hmm. That's like a very, very general rule, and there are a lot of exceptions to that, but it really, again, depends on the animal. So, while I say that in certain situations, it might make me a little bit less worried about something like an obstruction, there are times when vomiting and diarrhea together are more problematic, because if you can imagine, the more fluid you're losing from your body through your gastrointestinal tract, the more likelihood there is that you can become dehydrated or even go into shock. Because if you lose enough fluid from your gastrointestinal tract, eventually you're not going to have enough fluid in your blood vessels, and that's going to lead to shock. When I get most worried about that is in very small dogs. If they're having a lot of vomiting and diarrhea, especially if they're having bloody diarrhea, that signals to me that we, have to be a little bit more aggressive with how we handle them in the emergency room, because they can get dehydrated and lose a lot of fluid very, very quickly.
Mm-hmm. And when you see a dog presenting with vomiting and diarrhea, what most commonly is the prognosis of that or the outcome of that?
It's usually good, depending on the cause. There are some more serious causes of the combination of vomiting and diarrhea. One of the more serious ones would be parvovirus, which fortunately we don't see very often, because the parvo vaccine is very, very good at preventing parvovirus. Mm-hmm. If you have an unvaccinated dog, parvovirus is extremely contagious. That tends to be one of the causes of vomiting and diarrhea that has a worse prognosis, because that virus affects multiple organ systems in your body. Mm-hmm. And animals with parvovirus usually require hospitalization for pretty aggressive care. But in general, most animals with vomiting and diarrhea tend to do well. I would say that vomiting and diarrhea is one of the most common emergencies that we see in the emergency room. And most of the time, if the animal is, again, has a comfortable abdomen, if they're not too dehydrated, if we feel like they can take oral medications, we're usually able to treat them on an outpatient basis, mm-hmm. and send them home same day. That being said, again, there are certain patients who, if they have more severe vomiting and diarrhea, we sometimes need to admit them to the hospital for a few days of supportive care. And I think one of the big things to remember there is, if we send you home, you're going to have to be able to give oral medications. So if we really feel like a patient is extremely nauseous, and we give them an injection of an anti-nausea medication and it doesn't really seem to help them, that kind of signals to us like maybe this animal should be admitted for, a day or two of injectable medications to try to get ahead of this. But most of the time, most dogs with vomiting and diarrhea do quite well.
Mm-hmm. And at this time, can you say that you're seeing one cause of vomiting like more than any other as far as like recent trends that you've seen in your clinic?
I would say I've been working in the ER here for about 12 years, and dietary indiscretion is far and away the most common cause of vomiting that we see in dogs. I think people assume that dogs are like humans and they can eat a variety of different foods, but that's actually not the case for a lot of dogs. So far and away the most common reason is that a dog is fed something that they shouldn't have been fed, or that they're not used to eating, or they got a new treat. And that can cause vomiting. And a lot of times we also don't necessarily figure out the cause of vomiting. Similar, if we vomit, it can be an infectious thing, or they ate something, especially with how fast dogs are when they're on the street. They tend to pick things up really fast, and sometimes the owner doesn't even see it. But that is the most common reason that we see dogs vomiting. And fortunately, that usually responds to supportive care.
Mm-hmm. And if someone comes in and maybe and this seems a little more rare, and it might not be, but let's say the dog has salmonella or maybe E. coli, which I've never seen it in my dogs. I really don't think I know of anyone that's had that, but is that something you guys would be able to capture pretty quickly, maybe in like a fecal analysis or something like that?
Yeah, so those aren't part of a routine fecal analysis, but if we have a high index of suspicion for those conditions, we can submit fecal PCRs, they're called, to pick up on those things. That's usually more of a concern if a dog is fed a raw diet, which most dogs aren't fed raw diets, so we don't see that a ton. But those usually make an animal sicker, so those dogs, if they have that, they're usually admitted to the hospital. And if routine testing doesn't, give us an obvious cause, and we know there's a history of a potential raw diet ingestion, then we will submit that kind of testing in those patients for sure.
Okay. And then any advice that you have, having been at your clinic for so long and having seen every emergency case possible, any advice for pet owners to prevent having to come see you?
Sure. So I think, the number one rule is don't feed your dog things that they're not used to eating. I would stick to their normal diet, their normal treats. If they do well with those things, stick to that. They don't need to be fed other things, especially during times of celebration. Don't give them a big fatty meal. Be very, very careful with the kinds of bones you give them, especially, like I said before, like pork bones. I would definitely stay away from. Never a reason to give that to a dog. And then, in general, just think about things like if your dog is going to get car sick, definitely talk to your vet before you're taking trips to kind of plan for those things. So really just planning, sticking to the normal diet. If you have a dog who vomits when they eat too fast, do things to reduce the speed with which they eat, just really being mindful of those types of things. But in general, sometimes you can do everything right and you can still get into that situation. So just knowing when it's time to come in versus not. If your dog vomits a single time and they're still bouncy and they don't seem to be in pain, they're still following you around the house, in those situations I think it's very fine to wait it out. I usually recommend fasting your dog, so I wouldn't feed them again right away. Wait 8-10 hours until their next meal, and then try a small meal of a bland diet, and if they hold it down, you're most likely going to be okay, versus knowing when you really should come in. If your dog seems painful, if they're vomiting multiple times in 24 hours, if they're weak, if they're lethargic, if they're drooling a ton, if their abdomen's bloated, anything like that, then those are signs to come in. And again, better to be safe than sorry. That's what we're here for. That's our job. We're waiting for these animals to come in to make sure they're okay. So never feel badly about coming in if you're worried at all.
Well, Anne, thank you so much for sharing all of this. This is really helpful for everyone listening. And I know we've all been in the predicament where it's like, oh, they threw up, like now what? And then maybe they throw up again. Then it's like, is it time? So I think this is really helpful to try to look at it, not in a vacuum, but just like a totality of the circumstances and what's going on. And like you said, you know your dog better than anyone else. So you kind of know like, hey, this is a little abnormal. Like I said, thank you so much for the advice. We appreciate you being on.
Yeah, thank you, Brittany, for having me.
Thank you for tuning in to the Canine Culture Podcast. Please make sure you subscribe to the Canine Culture Podcast on your favorite podcast platform, and make sure you're following us on social media. If you have any recommendations, any topics that you'd like to hear, if you know of any guests that would be good for the show, or if you yourself want to be a guest, please reach out to us. Send us an email at canineculturepodcast@gmail.com or send us a direct message on social media. Thank you for listening, and please share this with any of your dog-loving friends.